Can you talk about if someone is testing positive and they get the results, what instruction is given to that person when they are sent home to quarantine?
If someone tests positive but they're not sick enough to be admitted to a hospital, what are they being told? And so what we're telling people is that they need to understand that they are potentially very contagious to anyone around them. And so what I recommend is people go and they go home, and it's no person-to-person contact. And that means the picture I try to draw is you go to your bedroom, and if you generally sleep with your spouse, either you go to another room or your spouse goes to another room, but you don't sleep together throughout this. Somebody will bring you food on a paper plate with a plastic fork and a paper cup, and knock on your door and leave it outside. You wait a minute, you go, you get your food, you eat it, you then take the paper products and you put them in a trash bag, and every 2-3 days you put the trash bag outside, and somebody comes along with another trash bag, folds it back to cover their hands, so they cover up that trash bag and they take it out. No person-to-person contact, and that is very difficult. So whether, we're doing this with both the patients that you described, the individuals who are tested positive, and if they're having symptoms, again, it goes back to the rule we talked about before with 3 days of no fever, improving respiratory symptoms, and that has to be at least 7 days in the first day of symptoms. Or the same rules apply for somebody who is on quarantine. So remember, quarantine is not a case. Quarantine is somebody. So, for example, in the situation you gave we'll say it's a spouse who tested positive and has symptoms. So you know what? Their spouse is a close contact, and they would be asked to quarantine while this person is asked to isolate. And so you can quickly see the problems it creates in terms of who's feeding who, right? And how we not because the assumption is that the one that is infected we know is infected, but the other one is possibly not infected. So the thing is, you don't want the virus going from this person to that person. So this is the one who needs to prepare the food, because if they are infected, well, they can't reinfect the first one. But this one can't prepare that one's food because they definitely will infect their spouse. So, again, a lot of coaching.
But what about any medical advice as far as Tylenol? And if people have symptoms but they are quarantining at home, is there something that they can do? I know there's not a vaccine, but is there something that people can do if they are experiencing pain, fever? Is there something we can recommend?
Yeah, so certainly if you're feeling uncomfortable, just like with any illness, go ahead and take the Tylenol, and stay hydrated is important, especially if you're having fever. There have been some reports about, which I don't think are founded, about problems with ibuprofen. And so at this point, there's nothing to scientifically back that up.
Let me just say, unless you're a camera person, if you could take your seat, please.
So consider that to be rumor at this point. But in the meantime, people need to stay hydrated, and if they want to take a fever-reducing agent, that's totally fine.